Welcome to the Sustainable Clinical Medicine Podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hello, and thank you for being a valued listener to the podcast. As part of a thank you, if you go to www.chartingcoach.ca/giveaway, we have a draw that will be happening. You only have to enter once. Each quarter, we will be drawing for a $150 voucher that you could use towards our paid workshops that we run each quarter with our amazing expert guests, or towards membership of the Smarter Charting or Charting Champions program. That address again, www.chartingcoach.ca/giveaway. And remember, if you're liking the podcast, share with a friend. Thanks so much for listening. Hello and welcome back, everybody. It is wonderful to have you here. Today we have with us guest physician, Dr. Arpita Gupta DePalma, who is going to introduce herself to us. We're going to have a great conversation. Welcome.
Welcome. Thank you, Sarah. I'm like, welcome. I'm not welcoming. You're welcoming me, but I'm saying thank you, Sarah, for having me on your show. That was a lovely intro. My name's Arpita. I love to go by Arpita. My nickname is Uppy, but friends and family call me that. But I am a retired pediatrician now. I used to have trouble saying that out loud because I really had a lot of pride. I still have a lot of pride in what I do. But I'm also a certified mindset coach with trauma-informed background, working with women physicians. I'm also the director of operations and kind of co-founder of our medical practice, Virginia Spine Physicians, where my husband is the medical director. I'm a landlord. I do a bunch of different things. Like, life is very full and very busy with all the things. And I think that's partially a little bit about what we're going to talk about today, about how we can start to create that balance for bringing back intention and joy into our lives. So short and sweet, but I think that gives you what you need.
Yeah, perfect. Good.
Yeah.
So tell us about you in your journey of medicine and some of the things about that as you became a pediatrician, or even before that if needed.
Yeah. So I was, well, to back it up a little bit more, my parents were first generation immigrants to the US. So I was first generation born in the US. They came from India in 1970. And, my dad literally came to the US with $8 in his pocket. And so having that work ethic of you work hard and you do a good job and you be an honest person working with integrity, that's going to get you success, was really ingrained in my brother and I growing up. And so that's kind of how, put the nose down and worked hard and just got to where we were. Got into med school, couples mash with my husband, and started that journey of life where we're doing residency training and finished that, started a career, started a family kind of at the same time. And it just kind of evolved and just happened so quickly. And so I had to be very, I had a very, I guess, predetermined mindset of I wanted to be present for my kids when I had kids. And so I knew that even in residency that I only wanted to work 2, maybe 3 days a week and then have the rest of the time to be home with them. So that kind of ideal situation was set in me early on. Now, of course, I was lucky enough to find that type of a job when I started working full time, and that was amazing. And it lasted for about 8 years. Around the same time, my husband decided to leave clinical medicine in an academic center and start his own practice. And so I was kind of dipping my toe in a little bit with helping from an administrative side role there. And around that same time, my practice asked me to go full time because their senior partner was leaving. And with that, it was a really tough decision for me because I knew that wasn't really fitting into that puzzle of what I wanted in my life. But I also knew I loved medicine, or I thought I had this definite need to be able to practice medicine no matter what I was doing. So I had to make a decision, and I got to the point where I said, I'm going to step down right now, so that I can be present for my kids at home. And I'm going to continue to look for something part-time. And in the meantime, I'll also be filling in and working to help get this practice off the ground, this new practice off the ground. And that's kind of what happened. And so I, one foot in front of the other, kept going, kept going. Mind you, 10 years go by and I'm still working as a primary administrative role in that practice. I did not go back to peds full time. I opened a locums company and did that on the side as well. And I had a lot of transitions in terms of getting to a point where I was actually happy and joyful with what I was doing at the end point. It wasn't happy and rosy and hunky-dory along the way. I was quite frankly miserable along the way. And some of the tools that I learned at the end are what allowed me to kind of make the shifts. And granted, everybody gets to that point, gets that gift at some point in their life that's meant to be for them. So I'm not going to say I wish that had happened earlier, but sometimes, yeah, you wonder. I wish I had those tools maybe a little bit earlier too. So
Yeah. Let's go back to residency. So you'd met your future or current spouse at that point in residency, is that right?
we met actually in med school, and then we couples matched and did our residencies at Ohio State together.
Okay, got it. And then when you were planning kids, was that while you were still a resident or once you'd completed residency?
So I did pediatrics, so that was a 3-year residency, and my husband was doing PM&R, so that was a 4-year residency. So in his final year, I was working in the urgent care, so I wasn't having the crazy hours of residency anymore. And so we had decided that towards the end, we would start trying to have a family. And of course, we were one of those lucky ones, I would say, the first try and boom, there you go. So before you knew it, I was pregnant, and I actually had our first child while he was doing his fellowship. So after his residency, we moved to Pennsylvania for him to complete a fellowship, and that's where we had our first child. So yeah, so it was after my first year as an attending essentially that it started with the family.
Got it. Okay. And then urgent care. So is that in pediatrics or what is that? Tell me more.
It was in pediatrics, and that was probably one of my favorite jobs, I would say, ever. Within Children's Hospital at Columbus, they have urgent cares throughout the city and even in their main hospital. So kind of low acute ER visits would go there. They'd triage them to the urgent care. So I did that for a year, all pediatrics only. And then we moved to Philadelphia for the fellowship. And at that year, I did take off while I had our daughter within the first 3 months of being there, and then was able to be home with her for that first year before we moved and started our real careers in Richmond, where we are right now.
Got it. Yeah. Tell me more about urgent care pediatrics when it's co-located with a hospital like that. I'd see that a lot of the emergency departments are overfilling right now, and we're looking for models that can create improvement for both patients and physicians working in those areas. What do you think about the model that you had seen as an urgent care pediatrician?
So mind you, this was back in 2003, so 20 plus years ago.
Yeah, that's okay.
But honestly, I absolutely loved it. It was a lower acuity visit. We did see some kind of, some of the higher acuities might be, a more severe asthmatic, some injuries that required suturing or maybe referral or getting a consult from orthopedics, et cetera, et cetera. But it was a great way to do quick visits, sick visits, allowing me to keep skill set up, allowing me to have, the connections with all of the different specialists in the hospital system. And just honestly, we just had a lot of fun. The other physicians that I worked with there, we just really enjoyed that version of clinical care. We didn't have to do the well child visits. We didn't have to do a lot of the the ADHD, those sort of visits. It was just acute care that was really fun, but it wasn't severe like traumas and such too. So I really enjoyed it. And I think that the hospital system at that time worked really well in terms of communicating with primary care as well as the ER departments to make sure we were getting the right type of patients. And mind you, that doesn't mean that sometimes we didn't get the correct patients, but we would just handle them by transferring them and doing the right thing for them. So
Got it. Yeah. And was it parents who would or was it triage in emerge that would help direct people to urgent care there? How was that kind of working?
it was, so the parents would present to wherever, to the ER
Yeah.
or to urgent care. Primarily, most of the time what happened was they would go to the ER, they were not acute enough to be in the ER, and the ER would send them to to urgent care. On the flip side, we would have patients that came to urgent care that were not appropriate for us. And that sometimes is a little bit more of a challenge to transfer them over to ER. But of course, if we didn't have the means, we weren't monitoring, we were closing, by the way, at 11 p.m., they would have to take the patients. So, there was that communication back and forth, and the nurses would help triage to get them to the right place. But every now and then there would be a miss. So,
Yeah, got it. Okay, thank you for that. All right. And then we have first baby arrives, moving again. That's a lot of moves, by the way.
well, I've moved, I think, 11 times in my life. It's crazy, but
Crazy. Got it. And then you're working in an attending position part-time. So tell me the navigation of that for you personally as you're working both in the home and in the workplace and little people. How's that
yeah,
work?
going back to again in residency, I had decided that I wanted to work part-time, 2 to 3 days a week, so that I could be present for the kids. I could participate with their activities at school, be available on the weekends, all the things. And so I was very deliberate with how I did my job search initially. I was only interviewing with practices that were looking for part-time positions. And actually, just to speak to kind of my mindset, I ended up joining a practice the first year I was here in Virginia and was hired for 2 days a week. But they very quickly, before I even started, increased me to 3 days a week due to another provider being out on maternity. And I did 3 days a week for almost a year. Mind you, my benefits and my compensation, all of that pretty much was for 2 days. And so when the year was coming to an end, I approached them and indicated, hey, you're going to have to change something here. I agreed to 2 days. That's what I want to go back to. Let's start that. And they indicated, okay, fine, we can get you back to 2 days, but we're not going to change. Sorry, I had it flipped. We're not going to compensate you accordingly. We're going to have to reduce things based on that. And that just did not seem fair and correct to me. So I left the practice. And at that point, I didn't have another position lined up. I just didn't like that kind of, leadership. And unfortunately, that was coming from two female leaders, and that was hard to that was probably my first encounter with working with other women professionals who were not there to uplift their fellow women colleagues. And so I basically said, I'll find something, it'll come, whatever needs to happen will happen. And while I was finishing out my term there, I had another physician who I guess I had submitted resumes to see me in the newborn nursery and approach me and say, hey, would you be interested in joining us or interviewing with us and meeting us? And so that's how that transpired. And I, again, very clear upfront, 2 days a week, that's all I want to do. And that's exactly what I did. I was hired for 2 days a week. That was an amazing job. It was a dream job. I started work at 10 a.m. I worked till 5:30, 6 p.m. Tuesday and Wednesday each week. And I would take call rotating once a month with the other providers. And I would be backup call for the nurse practitioners once a month. So it was just a wonderful setup. And I loved it. And I would have continued doing that probably forever had things not had to change. So yeah.
Got it. So when you were doing the 2 days, it was supposed to be 2 days, but it was 3 days a week. And you're in there doing, is it outpatient pediatrics at that point?
That was all outpatient.
Yeah. What about the work? Did the work contain itself to those 2 or 3 days? What was that looking
Yes.
like? Yeah.
Yeah. I will say I have always been very meticulous about the charting and getting things done while I'm out at the office. primarily because I know that I'm the type of person that if I don't get it done right there, I'm going to forget. And it's going to take me 5 times as long to get things done later. So I was pretty contained. I would get to work, I'd see my patients, I would finish my charting, and I would leave for the day. And I'd be very efficient charting as I went and all those things. So yeah, I would say pretty much so, other than on call when you're constantly needing to be available, I was working within those hours that were set for me.
Got it. In baskets, how did that get managed?
So again, I'm one of those people that does not like to see things piling up. So I would go visit my inbox between patients or during my lunch period. I would like go in there and review my labs each day. So I didn't really have inbox items sitting in my bucket at the end of the day. Now, granted, again, this is about 12, 15 years ago. But see, I retired in 2012 from practicing everyday clinical peds. So I know the volume of EMR messages has definitely increased since, but in terms of the basic labs and the referral work, all that going through, I would just get through it each day in between patients. Yeah.
Yeah, I'm just curious because when we've got people working part-time, sometimes that those 2 days a week, sure, but then the other days of the week, is there somebody else handling that in basket, or is that they're just waiting for you to come back on Tuesday, or is there some checking in between times? It's kind of that.
Yeah, I think my partners are really good about letting me know if something came through, if it was a stat result or a result that was really concerning. We were a good team. We would all work together and somebody would reach out to me and we would figure it out. And for that, with the rarity with that happened, when it did happen, it was not a big deal for me. Like that was one of the good things about that practice is that we all kind of just worked together. And at the same time, we also respected each other's time off when we were not working. I think part of that speaks to the collegiality that's also needing to be there without it being taken advantage of. I would give you one example. Every Thursday, they would have the physicians meetings, and I was not working on Thursdays, but that was something that I really wanted to be a part of. I didn't get paid for. I got the lunch when we went to lunch, but I chose to figure out a way to do that because I wanted to be part of that group and I wanted to be involved with some of the decisions making and just be in the know. And they let one of the MAs come to my house at lunch and watch my kiddos while I went to lunch with the doctors, had the meeting and came back and then relieved the MA and went back. I mean, it was just working together as a team and making things happen, which was really, really nice. And I know it's hard to find, but you have to cultivate that culture that we want to do something together.
Yeah. Well, that's a fascinating model, and I kind of excited by that, in that the doctors leave the office and go to lunch, which is like not a significantly normal or common way of doing things anymore, potentially. And one of the staff is sent to your house. Obviously, you weren't living an hour away, which is kind of another thing I'm noticing, which is also part of that, making decisions about what is sustainable within your practice. I want to come to this lunch meeting. I live close. The MA can come to my house. I can go to the meeting. I want that collegiality. It just demonstrates the decision making that's required to be able to do it in that way.
Yeah,
You've set things up at that point.
And I mean, it was a physician-owned practice, right? And that was the luxury of a physician-owned practice, is that we can do whatever we want to do within reason and limits. And it kind of goes to speak to why our current practice, that where my husband practices, we have no intent of ever selling to private equity or hospital system, because that autonomy and that independence and the ability to make decisions that serve your patients and your staff in the best possible way, you kind of lose a little bit of that if you have to go through different levels of layers of approval and red tape and all the things. So
yeah. So tell me about you moving into administrative work with husband's new practice. One of the flip sides of not selling to corporate is you have your autonomy, but you also have a lot of overheads, typically, like that ability to pay for a building, pay for staff out of the salary of, well, out of the income coming in from the income generators, like your physicians. So tell me how that kind of, you said, at one point you said, it was miserable. I'm like, let's tease that out a little bit. What's miserable? So kind of give us a little bit of an insight into what was going on with when we moved into private practice.
Yeah, and I guess to clarify, the misery was my own creation, right? And that is part of what I focus on working with now with women and physicians, is because that misery was coming from how I was choosing to think about everything that was happening. I really had no awareness of how I was thinking about things. I had no awareness that I could be aware of how I was thinking about things. And so everything that was happening in my world and my environment, staff quitting, staff stealing from us, staff blah, 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 all the things, insurance is not paying properly, us having to chase, us having to justify, everything was everybody else's fault. And that amount of frustration and anger that rose from that was honestly, yeah, some of it was warranted probably, but the tendency to sit in that and stay suffering in that was my own doing. And that's kind of where I think a big shift happened, where I noticed that I needed to make a change. And again, a lot of it, I think, with running a medical practice, being the owner of a medical practice, if you had to tell me what the biggest strains are, the biggest headaches, number one is staffing. Still, it's not changed in however many years we've owned this practice. Number two is dealing with insurance carriers and administrative crap. And number three is just trying to always not care about what other people think and knowing that you're doing the right thing for everybody, the practice, the patients, all the things. Because sometimes it will wear you down over time, not feeling like you're not meeting people's expectations or not making people happy. And that's where a lot of this work comes in, because it's all about how you're choosing to think about it. So I hope that answers, but that misery that I was having was definitely a lot of it self-generated. And it hit a high point with COVID, I would say, after COVID happened.
So when you say administrative, were you like the practice manager, like hire and fire of staff, making sure that the balancing of the books is happening, that we're dealing with the frustrations of staff and patients? Is that you? Is that what you were doing in that role?
The bulk of it, yes. I was monitoring. We had a third party handling our collections and all that stuff, but I was overseeing that to make sure things looked right. I handle all of the AP. I was handling the marketing, hiring, firing, the development of SOPs and implementation of SOPs. It was a crazy,
which is the practice, the way we practice in our
and yes, standard operating procedure, right? Exactly.
Yeah.
And so, it's such a huge learning curve that if you had told me in 2011 that you're going to know how to do all this, I'd be like, I don't know what you're talking about. But it's a gradual learning curve that happens sometimes even without you realizing it. But yeah, I was doing all of those things. And that's partially what contributed to my anger and frustration, was because I was like, I hate this stuff. I don't want to do this stuff, but I'm doing it. It's my sacrifice to my family. Since I can't practice clinically, I'm going to do this because that's how I'm contributing to our family.
Got it. Because you're right. It's a completely different skill set from medicine. There are some crossovers, like how much grit you can put in the game, and how quickly you may be able to learn new skills, but it is not what you were trained for, you could say.
Correct.
Where did you go for your learning about each of the pieces of putting a practice together?
So we were lucky to have a business consultant here in the area who actually helped start up and manage almost 40 different practices at that time. And so we were put in touch with him by, I can't even remember how we were connected with him. And so they helped us, and they help us still with all the pieces, the credentialing, the EMR, the billing and submission of claims, and then chasing denials. They help us with different pieces of it. And honestly, the way I learned is going in, being present. And so, yeah, I complain and I talk about this in my talks that I worked 60 to 80 hours a week doing this admin role when I was working 20 hours a week peds. And it was supposed to be, to be able to spend more time with the kids. And I was actually doing the opposite. But that's where I learned all of the stuff. That's where I learned how to navigate and work through things. And that's also where I learned that this is not for me. This is not my end goal. Right.
Well, tell me the reasoning behind not hiring a medical administrator and hiring you in that role as you're starting up a practice.
So we did.
Mm-hmm.
And this is also a huge area of my own personal growth because as a physician, you know very well, we are riddled with perfectionism. Everything has to be done perfectly our way on our timeline. And by the way, I'm going to still go back and double check you because it's probably not the best way that could be done. And so that was what really tainted our ability to keep office managers, was my tendency to, I wouldn't say necessarily micromanage, but maybe, yeah, micromanage, but then also go back and double check because I was the only one who could do things correctly. And so this is where a lot of the mindset work really came into play for me because I had to change that because my choice was I can continue to have high turnover in this managerial role because it has to be perfectly done my way, or I can start to let go and trust and have faith that people will get it done. It might not look exactly the same. And even if it's not perfect, it really doesn't matter in the long run. You know, that shift is huge, especially when you are a physician who has always been in control and in charge and telling people what to do, to be able to step back and say, okay, you do it. I'm just going to be here. It's not an easy step to take. So
yeah, it is a different skill set with our leadership skills for sure, to be able to say, here, I'm handing this off to you and I'm here when you need me, and having that capacity to watch for quality assurance, but not step in and fix. Yeah. Okay. So then you're working in part-time in pediatrics, and then that practice says, we need you full-time now because we're losing someone. And you said, I'm out. Tell me more.
Yeah, that was hard. It was hard because again, part of it was my upbringing, but part of it was just the belief that I had at that time that my worth was tied to my practicing as a clinician, as a pediatrician. And so if I'm not practicing as a pediatrician, I'm not really very worthy, very valuable anymore. So I didn't even realize that that's the thought that I had in my head until, again, years of doing some of the work to figure out what was going on. And starting to have the evolution of the belief that it doesn't matter what I do, I am 100% worthy. I am providing and offering gifts to the world, to the people in ways that only I can. That took a lot of time to transition to be able to believe. But yes, ultimately, that's why I left. I'm out. I was very unhappy, but again, the mindset was, this is my sacrifice because I want to be home with the kids and it's the best thing for the kids. But I'm also throwing away my career, which is not ideal, so shifting that perspective to, I might not be throwing it away. I might actually be doing something different that I truly, truly love and enjoy. Not the practice management at that time, what I'm doing now. It was a gradual evolution to get there.
Yeah. Okay, you also started a locum agency. Tell me more about that.
So before COVID, while I was doing the administrator work, I was miserable. As I said, I was in misery. And I thought, again, before coaching, that the only thing that was going to bring me joy again was being able to practice clinically. So I decided to start my own locums company where I would fill in locally in practices in Richmond when they had providers who are out for medical leave or maternity or vacations, and just kind of fill in and work there. And that worked out actually very well. I really enjoyed that. I didn't have any permanent ties to anything. I could go in, see the patients, check out to the physicians in the practice, make sure everybody was taken care of, and then kind of move on. It was a short stint because then COVID happened. And with COVID, nobody needed anybody pediatric wise in terms of primary care. And so that kind of shut down at that time. And that's when I started to really begin to reflect on, what actually do I want? Like, I have been doing all these things in search of what's going to make me happy, but ultimately I'm still not happy. So how do I get there?
Yeah. So what was that transition like? What was it about the coaching that you found that made things more tolerable, and then ultimately more worthwhile to you?
I think there were so many different steps to it, but I think the first piece was recognizing that just because I was a doctor, practiced as a doctor before, does not mean that that is what made me who I am, made me worthy of who I was, my name, my title, whatever, that I could choose to do something else and it didn't mean anything less about me. I think that was the hardest thing, especially when we had this upbringing from parents who came from India with nothing in their pocket and they're just really driving you have to be a doctor, a lawyer, an engineer. That is all in our brains. And so being able to pull that apart and say, you know what, this might have been true before, or this might have actually served me to get to where I wanted to be before, but it's not really true anymore. It's not really what is going to bring me joy and happiness now. That's I think the number one thing first that started that I don't have to do that now just because I did it before.
Mm-hmm.
And then, unwinding all that perfectionism that things have to be done my way. If it's not done my way, it's not going to be working out well and right. Um, that was really important to be able to start to let go and give kind of tasks to other people to take care of so it wouldn't have to be all on me. And then for me, what I noticed was a lot of the anger. I would have anger with all of these scenarios because that was what had become my go-to response. So I wouldn't have to deal with these painful emotions of feeling low self-worth or feeling like I wasn't good enough or wasn't doing the right thing. I would jump to anger. And so really starting to unwind why I was doing that, why I was going to angry when I wasn't really an angry person. That was the next step of the work where I was like, I think this is actually something that a lot of people might be dealing with that we don't even realize that it's become an automatic go-to. So,
Yeah, yeah. We see a lot of people within their clinical day feeling that anger as that automated reaction to somebody not doing something the way you ask them to, or asking for something that seems not what would be required in the situation, or those types of interactions with staff, and why can't you just do this too? Anger, you can see people jumping to anger quite quickly.
yeah.
So that sounds like a very valuable skill, and also working on that. It's got to be done my way, and it's got to be done perfectly, which
Mhm.
we absolutely understand in the context of patient care, that you want things to be done in a way that doesn't create more problems for patients, that it catches patients, create safety nets for them, that we are following up in the way that we should be following up as physicians. But it doesn't have to be done with such fierceness of
Correct.
frustration and anger, I guess is what I'm hearing you say.
Yeah, it doesn't
There's a
have to be done with
shift.
exactly with as much fierceness, as well as it doesn't need to trickle into all the other areas of our life, right? There are areas like that perfectionism is very valuable and it serves us when it comes to patient care, when we're trying to save patients' lives, but it doesn't serve us when we are trying to get the house cleaned up and get the dishes done and get all the clothes put away. I mean, those are the things where when we start to recognize that it's seeped into the areas that don't serve us, that are actually making us more miserable, that's when we have to reassess what's the best thing here for me? What do I need to really do?
Yeah, got it. Okay. It's good and valuable information for all of us who are pulling things from when we think. So in practice, we might see things that feel urgent and important and really truly have life-changing or life impacting decisions. But then notice when we're taking that home or taking that into other contexts and holding that less tightly. Yeah,
Yes,
yeah.
100%, 100%. And I love to talk about urgent versus important because, and I love to do this also. I talk to my director of operations. Is it urgent or is it important? Because our brain tells us everything is urgent. We have to do it. And that's not actually true, right? So being able to set aside a moment to think about whatever's coming at you to decide, is this urgent? I.e., I have to drop everything that I'm doing and address it right now because somebody's going to die or something ill is going to happen versus it's important. Yeah, it needs to get done, but I don't need to drop what I'm doing right now to make sure it happens. I think that's a skill set also that we've kind of forgotten how to decipher the difference between. So slowing it down a little bit to get to that point where we can say, okay, I can do this later. It's important, and I can do this later.
Yeah, very wise. Tell me how people can find you if they're looking to work with you, and then what you work with them on.
Yeah. I would say the easiest way to find me is on my website, www.thoughtworkmd.com. I'm also on Facebook and Instagram, thoughtworkmd.com. But I love to work with women physicians who are just struggling in any area. Anger is one of my niches because I suffered from that significantly. I hated the way I was showing up with my kids, and I wanted to be a much more happy mom. And I'm a pediatrician too, so it probably would be beneficial. But yeah, I work with anger. And the thing with anger is a lot of people don't think they're angry. They say, I don't need that. And it's recognizing that there's oftentimes underlying memories or traumas that we might have had that are contributing to how we're responding to situations we're facing now. So a lot of the trauma-informed coaching, working a lot with processing emotions, being able to tap into emotions, because as physicians, again, we oftentimes have lost that skill set to be able to know what we're feeling and how it's showing up for us. So doing that, helping women just kind of achieve their goals in a much more calm, peaceful, happy, joyful manner.
Got it. Perfect. What about now with the business as it's going along now? What is your role in the business, the husband's, where he's practicing? What are you doing in there now?
So now I am primarily a consultant. So we have a director of operations who manages the day-to-day. We have a clinical lead who manages the clinical side as well. He's a newer hire, so we're getting him up to speed. And I just am there. I pop in once to twice a week to sign off on paycheck, or not paychecks, just AP checks, decide if there's any things that they need help with in terms of my input on how to navigate and manage. And that's really about it. It's lovely.
So that full circle of ability to delegate, get things going well, that inputting to help navigate those systems and processes so that it can become a machine that doesn't need you there every day.
Yes, 100%. And it's doable. It's just starting. You have to really just pay attention to what your thoughts are about why you can't make a change, and then really start to pick those apart to figure out if it's really true and serving you. So.
Perfect. Any other words of wisdom, things we didn't touch on today that we should let listeners hear before we head off for the day?
Oh my gosh. I would say just listen to your inner knowing is one of the biggest things that I talk about in when I talk to clients is, you know, in your heart what you want. We just oftentimes don't listen to it, or we listen to voices that tell us why we can't have it. And I would like to offer that I want you to listen to it and instead maybe work with someone, if you can't do it on your own, to figure out how you can get it. Because that's the key to your own happiness and your own sustenance, to be able to live the life that you want to live.
Yeah. I really like that you had goals well at the beginning to say that I want to have a family, I want to be home for them, I want to be present with them. And then seeing that navigation as you move through different parts of life and career and then into new areas, still keeping that in mind as you worked through things. Yes, there was a period there that you worked up very hard.
Yes. And I'm just going to throw this one little piece out there is when we're empty nesting now. My son's a freshman in college, and his senior year of high school, he was on the football team and just all the things. I was in the middle of doing a different podcast that I'm doing right now. And I had made the decision that I was going to do anything and everything that came up with him, including if the boys came over after football practice and decided to be downstairs in my kitchen for 2 hours, I wanted to be available. And so I gave myself permission for that whatever comes up this year for him, if I want to be present for it and participate, I give myself permission to cancel whatever else is there. And that was the best decision I've ever made in my life. So giving yourself permission to do what you want to do that brings you joy and happiness is ultimately the key to your own just being able to live with intention. So just do that. Listen to it and do it.
Beautiful. Thank you. Find ways to make it happen. Thank you so much for this conversation. I appreciate you, and have a great week, everybody.
Thank you.
Bye. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more, or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.